Hi, my name is Emily Banks, and this is my SportsMed 3 Unit 3 program on injury prevention for hyper knee extension. Hyper knee extension is typically defined as when the knee angle over here is bent backwards in an angle above 10 degrees. This can be the factor of many things, including weak quadriceps, a history of knee injury, improper technique, imbalance in strength and stabilization, and so many other things. Having a hyperextension basically means that your knee is unstable. Having an unstable knee can lead to several injuries, including cruciate and collateral ligament injuries, forced hyperextension, which can then lead to patellar dislocation, instability overall, which means that you're prone to twisting and tripping, meaning fractures, contusions, and more. Going into the more specifics about my program, I will introduce you to my patient, Travis Banks. Travis is super into rock climbing, biking, and snowboarding, but he doesn't really do any injury prevention or conditioning before going out and doing these activities. This means that he's super prone to injury and has been injured before. Travis also, of course, has hyper knee extension. Well, he barely has it. On his left leg, he's a little under the requirements of the 10 degrees by having only 6 degrees, and on the right, he has just barely made that mark of 10 degrees. Travis, as well, we decided to record his flexion, and he's right within the mark of having good flexion, which is between 130 degrees and 140 degrees. Our goals for this program isn't to cure his hyperextension, because as cool as that would be, it's kind of unrealistic. Our main focus is, however, to stabilize his knees to prevent any serious injury in the future. To do this, we'll focus specifically on muscle recruitment and getting his muscles familiar with fast-paced activities that could be his unstable knees' demise. We will do this by focusing on fast twitch, which is the type 2 muscle fiber training. Fast twitch muscle fiber has two main types. The first type is more endurance related, which you would see in about 400-meter sprints and repeated lifts. And there is the second type of fast twitch fibers, which fatigue a lot faster, and you would see more in 100-meter sprints and max lifts. We will focus on these because they will help with recruitment and muscle and also help in getting him faster and training his muscles to react quicker. As well, we will focus on his posterior complex muscle recruitment, which involves the soleus, calcaneal tendon, the head of the gastrocnemius, and the plantaris. And then we will also work with ROM and stability, specifically of the hip and the ankle, as well as distributed stability and strength amongst his whole leg, specifically strength in the quads though. Before we move any more into the program, I would like to go over the importance of the hip and ankle stability, because when the hip and ankle are not doing their job and acting as a stable structure, the knee is left compensating for their instability. In this slide, you can see on the left how we are measuring Travis's ankle stiffness by having him put his knee towards the wall while having his ankle at a certain distance away. You can see that he's about at 3.5 inches on his left knee and 3 inches on his right knee, which isn't really where we want to be when we'd rather be more at 1 or 2 inches. And then on the right side, you can see Travis doing the Thomas test. He does pretty well in both of them and doesn't necessarily fail them, but we would prefer if he had a bit more laxity and if there was a bit more stretching going on without his leg coming up. Getting back into the program, I will be having Travis do a HIIT program. This is a high-intensity interval training. I'll have Travis do this twice a week in order to give him time to rest and release all that lactic acid buildup, which is super common with fast twitch training. As well, I will have Travis repeat the HIIT program about 2 to 3 times every time he does it, depending on how he feels. As well, each exercise is about 45 seconds with a 30-second break every 2 exercises he does. To start off with though, we need to do a warm-up. This warm-up, 20 seconds each of each exercise, includes deep squats, standing toe touch kicks, open the gates, and high knees, each one being done slow as to not accidentally twist or injure anything. Then we will go into the actual program. The program will include glute bridges, jump squats, skiers, and calf poppers. This is an inclusion of some plyometric stuff and able to get that high intensity and muscle recruitment that we were originally talking about. These all include different muscles being brought in, including the glute, quads, the lower back, hamstrings, and a lot of calf stuff. Then is the other part of the program. This includes ski jumps, vertical jumps, burpees, and jumping lunges. This as well includes a lot of calves, a lot of ankle being brought in, a lot of quads, a lot of hamstrings, and especially with the calves is good is that it brings into the posterior complex, which we were talking about in the beginning. Lastly, we want Travis to go through with stretches. This I had Travis go through was hurdlers, butterflies, leg swings against the wall, pulling his knee into his chest, and the combat stretch, which is super good for ankle instability and hip mobility, which we were earlier talking about, as well as hip internal rotation, which you can see on the bottom, with Travis having both legs kind of out at an angle of about 60-ish degrees, and then bringing one leg in to create that hip mobility and internal rotation. To finish off, we'll look at results, which we did by remeasuring his hyper knee extension ROM and just his flexion ROM as well. When looking at it, you can see there is an actual drop in both of his extension remeasurements, with -2 on the right leg, -4 on the left, and for his flexion, there was a drop in his right leg by -3 and an actual raise in flexion by 7 on his left leg. If I were to redo this program, I think I'd prefer measuring with a different way, whether that be strength or muscle recruitment time, to go over what we were talking about with goals and what we wanted to see. I just didn't realize this soon enough into the program and didn't have enough time to really get those baseline measurements before the end results were already upon us. Anyways, that's all for my program. Thanks